AndropausSpecialist.com, Section 4. Frequently Asked Questions. What is andropause? You may be wondering what causes andropause. It's a natural emotional and physical change that occurs as you get older, and it's caused by a decrease in male hormones. Symptoms of andropause include low sex drive, difficulties getting erections or erections that aren't as strong as usual, lack of energy, depression, irritability and mood swings, loss of strength or muscle mass, increased body fat, and hot flashes. What causes andropause? If you have andropause, you may be wondering how you got it. Other factors may be contributors, but the primary is that as men get older, their testes don't work as well. Something called Leydig cells produce testosterone less frequently and in a lesser quantity. Other reasons are that the hormones that produce testosterone just aren't creating as much, and some of that testosterone is being converted to other hormones like estradiol and DHT. How is andropause diagnosed? You usually detect andropause by its symptoms. Therefore, in order to get a full understanding as to whether you fall into this category, you'll undergo a couple of screening procedures to aid in proper diagnosis, including ADAM questionnaire, RigiScan, full hormonal panel, physical exam. Andropause diagnosis. To determine if you have andropause, a blood test is necessary for measuring testosterone levels. While it's true that decreased testosterone levels are a factor, other issues may weigh in. For instance, more sex hormone-binding globulin may limit testosterone from traveling to the tissues. Also, where testosterone levels would rise and fall when you were younger, you may now be experiencing a flattening and lower level of production. A few issues you should be aware of. The definition of low testosterone varies. Generally, 2 standard deviations below the usual rate for a younger man is considered deficient. It's important to look at your testosterone levels over a period of time because they may vary from one day to the next. In older men, affected organs may respond differently to androgens. Also, there is no one right level of testosterone for all men. You and your doctor need to work together to establish the level that's right for you. A testosterone level less than 200 nanograms per deciliter is considered low. If your total testosterone levels are over 600 nanograms per deciliter, then low testosterone is probably not the cause of andropause. A doctor will look at testosterone levels as well as other symptoms, such as low sex drive and erectile dysfunction, before making a diagnosis of andropause. What's the best way of measuring testosterone levels and diagnosing andropause? Opinions vary. The analog-free testosterone method is most widely used by large commercial U.S. labs. We feel that a more accurate measurement is either free testosterone or bioavailable testosterone done in a specialty laboratory setting. While there is some variation in what test should be used, it's widely accepted that blood work should be done prior to 10 a.m. to capture peak values. Interpreting testosterone levels is complicated. That's why it's important to see a physician experienced in this field who has a relationship to a specialty lab. It makes interpreting the results that much easier. What are the treatment goals for andropause? First, know that treatment for andropause is often very effective. The objectives of your treatment include restoration of sexual functioning, increased libido, increased sense of well-being, prevention of osteoporosis by optimizing bone density, restoration of muscle strength, and improved mental functioning. This completes Section 4, Frequently Asked Questions. To make an appointment with Dr. Werner, please call our offices in Westchester or New York City. Westchester, 914-997-4100. New York City, 646-380-2700. Manhattan office, 110 East 40th Street, Suite 704, New York City, New York 10016, 646-380-2700. Westchester office, 2975 Westchester Avenue, Purchase, New York 10577, 914-997-4100. 4100. Connecticut office, 148 East Avenue, Norwalk, Connecticut, 06851, 203-831-9900. Offices are wheelchair accessible. We hope you enjoyed this tour of the New York Andropause Center website. Thank you for your participation.